so we got a patient here, and we are going to be addressing this bunion deformity. So this is the bunion. So you can see a bunion is composed of this big bump on the inside of the foot, and also the fact that this toe is going in that direction, and it oftentimes will rub against the second toe, and even in your case, go under the second toe. So you can see that it's actually the first toe and the third toe are actually almost touching. This guy is kind of just floating in the air. Well, tell me about this bunion. How is it giving you trouble?
Well, it rubs against my shoes mostly. And when I walk, sometimes it's painful and sometimes it's not. Depends on the shoes I wear. That's the biggest problem I have.
With the rubbing, I'm sure.
Rubbing on my shoes.
And what we're going to do here is we're going to be making a very small incision here, a very small incision here, and a very small incision here. We're going to smooth down this bump. We're going to make a little cut in the bone here to bring the big toe off of the second toe. I'm going to numb you up here in a second, but remember, we're not going to be doing any screws, we're not going to be doing any plates, we're not going to have any wires shish kebabbing out of the toe. You're going to be able to walk right out of here, and I'll show everybody what it looks like in the operating room. So we got the patient all scrubbed, prepped, and draped, and you'll see a couple lines on the foot, but what I'm going to be doing is just making a small little poke incision here where this little X is, a small little poke hole incision here where this little line is, and a small little poke hole incision right here on this side of the toe. You can see our x-ray here. This is the x-ray before we've even done anything. And what you're going to notice once we're done with everything is that bump that's right there. That's the bunion bump. That's going to be gone. On the x-ray, you can see that that big toe is tilting and hitting the adjacent second toe. So after surgery, you're going to see me taking a wedge of bone out of that toe. That's going to allow me to pull the big toe off of the second toe. Patient's good and numb. So I'll show you guys what this looks like once we're all done. So we got the patient all sutured up, and we have 3 little poke hole incisions here. And from this incision, I was able to smooth down the bump, so you can see how much reduced that bump is here. This is all just soft tissue here. This incision right here allowed me to make a little cut in the bone to wedge it to the outside, and I released some of the soft tissue right there with that incision. But really best to look at it on the x-ray, and you can see with that small incision how much bump I was able to take off of the bunion. And then that other cut in the bone you see right there is going to allow me to swing the bone off of the second toe. But I'm going to put the dressing on the patient right now. She's going to walk right out of here. How's everything up there, my dear?
Great.
Awesome. We're going to put a dressing on you, and you're going to be on your way.
Okay.
So we are now 6 weeks out. This patient had the Emerald Bunion Transformation on this foot here. And I'll show you guys real quick the little incision site. So it's a little poke incision there, a little poke right there, and a little poke right there. Patient's got phenomenal range of motion. Any pain when I move this toe?
None at all.
Any pain when I'm pressing?
No.
Any pain here?
Nope.
And you can tell that we took off the bump, and then we made a wedge cut in the bone to essentially hinge the toe off of the second toe. I'm curious, what was the surgery process like for you? Can you kind of walk us through that?
Well, yes, I can. I mean, it was absolutely simple. I mean, once you did the surgery, a week later, it was virtually painless. I had no problems at all.
And you were walking day of surgery?
Yes.
How long until you started to drive after surgery?
A week.
Okay.
Yeah.
Perfect. What about pain after surgery? Were you having to take any of their narcotic pain medication?
I did I know I did the day of that evening of the surgery and the next day. And then I think maybe a couple of days later, I took one of the tramadol, and that was it.
Did you have to take any ibuprofen, Tylenol?
Nothing.
Fantastic.
Yeah.
And how is it feeling now, 6 weeks after?
Wonderful. That was wonderful.
Great.
Yes.
Well, fantastic. Anything you'd like to say about the process? Anything else?
If you're having bunion pain, do it. That's well worth it. It is well worth it because it's painless and it's only 6 weeks.
Well, thank you so much for sharing your experience.
Sure.
Thank you.